Here's more proof you actually should be that specialize in a healthy diet. You might want to shift your focus from your morning supplement routine to your diet if you are looking to reap the advantages of vitamins, a replacement study says. Researchers at Tufts University have found that nutrients from food are related to living longer, but an equivalent cannot be said for vitamin supplements. The researchers analyzed data on quite 27,000 adults within the U.S. to gauge the link between dietary supplements and mortality. They found that the lower risk of death related to adequate nutrient intakes of vitamin K and magnesium was limited to nutrients from foods, not from supplements, a press release on the research says. Additionally, the researchers found that getting enough vitamin K, vitamin A, and zinc via a diet lowers your chances of getting disorder. Getting enough of these three via pills, though, doesn't have an equivalent effect. On top of that, the researchers found that getting an excessive amount of calcium from supplements, defined as a minimum of 1,000 milligrams a day, increases your risk of dying of cancer. But that relationship doesn't exist if you're getting that much calcium from food, the study found. Another interesting finding from the new research, if you're taking vitamin D without being vitamin D deficient, you'll be increasing your chances of dying of cancer. However, more studies are needed to solidify this finding, the researchers warn. As potential benefits and harms of supplement use still be studied, some studies have found associations between excess nutrient intake and adverse outcomes, including increased risk of certain cancers. Fang Zhang, MD, PhD, lead author of the new research, explained during a statement. Our results support the thought that, while supplement use contributes to an increased level of total nutrient intake, there are beneficial associations with nutrients from foods that are not seen with supplements. To be clear, there are a couple of legitimate reasons to require supplements. For instance, you would possibly want to think about taking zinc, copper, and B vitamins if you've got inflammatory bowel disease. If you've got osteoporosis, it's possible that you're going to enjoy taking vitamin D and calcium. But most folks can probably get the vitamins and nutrients we'd like from eating a spread of nutritious whole foods, Heather Kaplan, Rhode, previously told Health. If you're getting to use a supplement, keep a couple of things in mind when buying vitamins from our buyer's guide. For starters, avoid buying supplements made in China, where relaxed regulations could lead onto contaminated products. You ought to also avoid discounts when you're buying supplements. The recommended dosages of cheaper products are less likely to match established standards. Refrain from taking supplements that include kava, an ingredient linked to liver damage, chromium, which is related to anemia, bitter orange, which is related to heart attacks and strokes, and contaminated L-tryptophan, which is linked to neurotoxic reactions. If you are doing gut to take a supplement to treat a medical condition, confirm you're cautious when choosing which one to swallow every day. If you're healthy enough to avoid supplements, though, specialize in getting enough vitamins through a diet instead, research advises.